Seasonal affective disorder, or SAD, is a topic you may have heard about this time of year. But what is it exactly? Is it a real medical condition, and can you do anything to alleviate the symptoms of the disorder? Hi, I'm Dr. Kia Stagar with Mayo Clinic Health System. First off, seasonal affective disorder is a variation in mood related to the season. It actually is considered a subtype of depression. It's important to point out there are actually two types of seasonal affective disorder: fall-winter onset and spring-summer onset. The one you've most likely heard about is during the winter, with symptoms typically appearing in early fall to early winter and improving usually in the spring. Here are the symptoms of fall-winter seasonal affective disorder. Many are similar to depression and may include a change in mood, reduced energy levels, changes in sleep, typically the need for more sleep. People with a SAD may also withdraw from people and activities that they enjoy. They may also suffer aches and pains. Many notice an increase in appetite for food cravings like carbohydrates, and not surprising, many report weight gain. So how many people are we talking about? Estimates vary, but up to 10% of primary care patients will report symptoms to their doctors. For those with a known history of depression, the number is higher, roughly 15%. Seasonal affective disorder rates are higher in the northern states when compared to the southern states. One theory of what causes seasonal affective disorder has to do with light, or rather the lack of light during winter months. It's believed our body's circadian rhythm, or internal clock, can get out of balance during the winter months when there is less daylight. We also know that serotonin levels play a role in depression. Many people with SAD have a decrease in serotonin. It so happens there's a natural change in serotonin in our brains between winter and summer months. So if you're diagnosed with SAD, what can you do to feel better? Medications to increase serotonin is one option. Vitamin D supplements, regular exercise, especially aerobic, and good sleep hygiene can also help. That means turning off all technology at least 1 hour before going to bed, eliminating long naps, and keeping regular sleeping and waking times, even on the weekends. Another option is light therapy. Most patients with seasonal affective disorder or underlying depression or bipolar disease that worsen in the winter will respond well to increased light exposure. You may see benefits from walking outdoors every day for 30 minutes on a sunny day or up to 2 hours on a cloudy day. However, the reality is most of us do not have time to walk 2 hours a day, and we work in offices with indoor lighting. A light box or lamp is helpful for many with SAD, and something I use myself. When looking for a light box, check for a lux rating. Look for one that is 10,000 lux. You only need to use the lamp for 30 to 60 minutes in the morning. If you use it too long, it can actually make it harder for you to fall asleep. It's important to use the light shortly after awakening and around the same time each day for the most benefit. Be careful not to position the light too close to your face or stare directly into the light, and always follow the manufacturer's instructions. I use my light box every day in the morning, and yes, I work in a windowless office. Typically, many people see improvement in their symptoms in just 1 to 4 weeks with consistent light use. There are many models and sizes of these lamps, so take the time to research and find the one that's best for you. Finally, for those of you who have a hard time getting up during the dark winter mornings, a dawn simulator is another item you may want to check out. A dawn simulator is an alarm clock with a light that gets progressively brighter 30 to 60 minutes before the alarm goes off. Just like a light box, there are many different styles available on the market. If your symptoms persist or worsen, please contact your primary care provider and talk to them openly about your concerns. They can help create a plan to make the long winter months a little bit brighter.